Hello to the VA community. My name is Dr. Osama Chowdhury. I work as a neurosurgeon at NYU and I'm co founder of Mediviz. And it's a great honor to present before you all virtually today. And I'll be speaking about how we're working with the VA to use augmented reality for safer surgery. First, I'd like to start with how my own journey has inspired the work we're doing with Mediviz. Um, so I trained in neurosurgery at NYU. It was a 7-year program, and during all 7 years of my training, I had the privilege to take care of hundreds of veterans at the Manhattan VA. And basically, our department would take care of any veteran who walked through the door who had a surgical disorder of the brain or spine. So it really was a privilege and an honor. And there's one case I remember, one veteran whose um, surgical care really motivated uh, most of this work. And this was a young veteran. He came into our clinic with his family and he presented with what's known as aphasia, which is uh, losing the ability to speak. And an MRI showed that he had a very large brain tumor pushing on the left side of his brain. And it was pushing and invading into a network of arteries that were supplying his brain with blood. And this is something we needed to operate on before it affected his speech permanently. So his operation was actually one of the longest cases we had done as a team. It lasted over 10 hours, a very delicate surgery. We had to use microscopes and very fine instruments to peel the tumor away from the blood vessels at the base of the brain. And now imagine if you're operating for 8 hours straight, standing under a microscope, and you get to the critical part of the case where you're getting to encounter these network of blood vessels, and you need to really understand what you're doing at that point. And all you had to rely on was the MRI scan that was up on a monitor in the corner of the operating room. And so I clearly remember our lead surgeon. He stepped away. This was 8 hours into the case, and he went to the corner, and I'm scrolling through this MRI over and over for him so that he can mentally recreate what he's seeing through the microscope. It was a very frustrating experience, and we all kept thinking, this imaging is such critical information. There has to be a better way of seeing and understanding this than just 2D slices. And the frustration that my team felt there that day is something that surgeons feel over and over again when they're performing operations. And the problem is actually very simple. It's why are we still using 2D imaging if we're trying to understand and solve a 3D problem? And if you take this problem and think of it in terms of how many operations we perform around the world every year, literally hundreds and millions of them, all the surgeons and physicians, they're using this same source of data, these same 2D images that we manipulate in our minds to figure out what we're doing three-dimensionally during an operation. And so really for us, the question was, can we provide a technology that can allow for access to advanced visualization for surgeons? And if we can, how many errors or complications could you prevent with that sort of technology? And if you think about how imaging has evolved over the last century, we started with X-rays back in the early 1900s. We moved to CAT scans and MRIs, and today our computational power is incredible. But since the last 50 years, we are still looking at imaging in the same way. We're still looking at it on a monitor and scrolling through slices. And so our focus at Mediviz is on how do you start taking this imaging data for patients and use augmented reality and artificial intelligence to recreate the exact three-dimensional views that surgeons need for an operation. And we call this technology surgical AR. It was cleared by the FDA last year, and the VA healthcare system will be among the first hospital systems in the country to have access to it. And we work very closely with Microsoft. We use their HoloLens augmented reality technology. And this is all real imaging data of patients that's being used to recreate the holographic renderings. And this is all done in real time and automatically, so surgeons throughout the VA or in any hospital can use it anywhere and at any time. Beyond just surgical use, our VA healthcare system also ends up training about 70% of our country's physicians. And so, we have a huge core mission on how do we use this same technology to advance their education as well, so that when they have important concepts they need to learn about anatomy and physiology, and not just our trainees, but even our patients who need to understand their own anatomy and physiology, how can we use this holographic rendering technology to improve and advance their understanding? So our partnership with the VA is something that has been a huge source of honor for us. It's under a large national agreement called Project Convergence, and it actually involves Microsoft and Verizon as well. And this is Dr. Osborne at the Palo Alto VA, one of the leaders in the initiative. And it's really been an honor to partner with the VA on this. And over the course of the next year, there's going to be some fantastic research coming out of this collaboration. And like I mentioned before, the VA healthcare system will be among the first in the country to have access to this technology. So it'll first be deployed at 5 VA sites to start. That includes Palo Alto VA, Portland, at Puget Sound in Seattle, Philadelphia VA, and the Simlern Center. And obviously, our goal is to work with the VA to bring this technology eventually to every VA hospital where surgical care is given to our nation's veterans. And so if your institution has surgical departments that could use this technology, I encourage you to reach out to your VA Innovation Department to learn more about it. With that, it was really an honor to speak virtually before you all. We look forward to sharing details on how this collaboration will advance augmented reality for surgery in the coming years. Thank you.